Hello, my name is David Border, Doctor of Optometry. This video is for patients to learn how to put contact lenses into their eyes, how to take them out of their eyes, patients that are new to contact lenses. I think it's important to note that contact lenses should only be used under the care of an optometrist. You shouldn't borrow your friend's contact lenses. You shouldn't buy contacts at the swap meet and put those into your eye. If they're not fitting correctly, if your eyes aren't healthy, there can be problems. So you want to make sure if you're starting out with contact lenses and something doesn't seem right, you have somebody that you can call, somebody that can see you right away if there's a complication. So when it comes to contact lenses, handling contact lenses, the most important thing is hygiene. And of hygiene, the most important thing is to always wash your hands before you handle your contact lenses. So my recommendation is to use a dish soap or hand soap and wash your hands. You do not want to use alcohol wipes or alcohol on your hands. If you have any remnant of that, you will get that onto the contact. That will cause a chemical burn, which will only last about a day for the most part, but it's something you don't want to experience. It's uncomfortable, very uncomfortable. Okay. And then I'm going to set up my station here with contacts to have this towel sitting on top of the sink so that if I drop my contact lens, it's not going to fall into the dirty sink or down the drain and get lost. Here is a blister pack. So this is how the contact lenses will come in the package. I'm gonna fold it here, crease that foil so I can get a nice clean opening there. So when it comes to opening the contact lens, there's a glue ring right there. I'm just gonna slowly peel that open, see a little bit of solution squirts out. And then I'm gonna take the contact lens, take my finger and my right hand here because I'm right-handed, and I'm gonna scoop, and I can see the contact lens is on there. You might only be able to see that there's an area that glistens right on the side there. For the most part, when you take the lenses out of the packaging, they're already in the proper direction. So what you want to do is set it right in the palm of your hand like that, dry this finger off, and scoop under it. You want to scoop it so that the lens is only touching the finger right in the middle there. There's a nice little ring there. So the brute force method to put a contact lens into your eye is to take your hand you're not using, your non-dominant hand, look down, touch your eyelid right there, right where the lashes come out, pull that tight to the bone there. Take the other hand, pull the lower eyelid, also right where the eyelashes come out, pull that down. Adjust your head so that the colored part of your eye is in the middle and the white part of the eye you can see a nice ring, and then just bring the contact lens straight in and touch it straight to the colored part of the eye. Just barely touch it. The lens should transfer. Now, if your finger is a little bit wet, like mine is there, then the lens might stick to your finger. So we're gonna do one more time, get that centered nice, right on the tip there. And then again, pull that lid up, pull this lid down, bring the lens straight in, just like that. And then you maybe let go of the lower lid, look up, down, left, right, 360, let go of the upper lid. Slowly blink. The vision will start out being a little bit blurry because the eyes are watering a little bit, but as the lens settles in, the vision locks in. If you're not sure if the lens is in your eye, maybe wait a minute and cover the other eye and look far away. And I can tell that the vision's nice and clear, so I know that the lens is incorrect. So once you have the lens in, you wear it. I usually recommend maybe 4 hours, maybe 6 hours the first day. Slowly build up your wear time. Hopefully you can build up to about 16 hours a day comfortably. That's about as much as long as you would need to use a lens in a day. And then at the end of the day, you get home, you wash your hands. You're tired, but you need to be real careful about this. And so you're going to remove the contact lens. So for that, I find the easiest way is if I point my eye straight ahead, take my either hand here, but I can take my right hand, pull the lower eyelid down just a little bit, and I'm just going to gently touch the contact lens and kind of drag it down in gentle little motions until it's mostly down to the bottom. And then I'm going to take my thumb and my index finger and pull the contact lens out just like that. And I can see that the lens kind of folds up there when I took it out. So I'm just going to prop it back the normal way, and then I can put that back into my case. So now I'd like to show one way of how to put a contact lens in specifically for patients that are used to touching their eyes already. They're using mascara, they're using eye makeup. It's not too uncomfortable for them to touch their eyes. So this might go a little bit faster with this technique. And for that, instead of having the lens sitting on my finger like that, I'm gonna take the lens and put it on my finger like this. So I'm holding my finger pointing directly to the side, and the contact lens is sitting upright on the end of my finger like that. And then you can take the other hand if you want, pull the lower eyelid down. I'm going to tuck my chin way down, and now you see this nice white arc of the white part of my eye, and that's where you want to mostly put the contact lens, sort of center it right on there. Now whenever I bring the lens to my eye, I'm careful that the whole ring of the lens is all the same distance from my eye. If I'm coming in at an extreme angle, then it's not going to go. A lot of patients will do this for 20 minutes just at an angle. You have to make sure it's coming with the lens straight toward your eye. So this other method here, again, this one's a little bit easier when the patients are, and the lens is on there. You can see there's some wrinkles in there. Some brands have this problem more than others. I just kind of massage it in there, and then there I can see my vision starting to come into clear focus. And that I think is a little faster way to do it, but doesn't work so well. You know, some people have a very strong blink reflex. When they try to bring anything closer to their eye, their muscles will just cramp right up. And if that's a situation for you, the first method does tend to be a little bit more consistent. So that's putting the lenses in. I'd also like to look now at how do we know if the lens is inside out or backwards? Sometimes if you take the contact lens out, you might fold over or roll over, and you might not know if that lens is in backwards. So here I've removed the lens, and it's kind of folded up. I'm going to put some contact lens solution onto the lens. Okay, and that will, it'll be a little bit easier to manipulate the contact lens. So I could sort of take some of this fluid and just kind of wipe it away. And so I could show you here the way that you clean a contact lens. You put the solution right on top there, multi-purpose solution, and sort of massage the lens against your palm. Go side to side, go up and down. You kind of want the lens to stick on your finger some of the time, so the front of the lens is getting clean, but you also want it to stick to your palm some of the time so that the inner side of the contact lens is getting clean. So then once you mostly clean it, I'll just sort of wipe away most of that fluid and prop the lens back up into my palm here. And then now I'll dry this finger and sort of scoot under it there. Okay, yeah. So there's a lens in profile, and it's kind of hard to tell, but if you look on the sides, it kind of looks more bluish. The edge of the lens is kind of rolled up like a bowl. It kind of points up and out. Now, if I flip the lens the other way on purpose, Let's say that it got flipped away somehow. And same thing, when you take a look at it, you can tell that the edge of the lens looks a little bit more pointed out and not up. It looks more, I would say, more like a plate and less like a bowl. This is the lens backwards. Now, another way we could do that is what we call the taco test. If you take the lens and look at it from this same angle and you kind of squeeze the lens together, you'll notice that it's very difficult to get the ends to touch. If we flip it the other way and do the same comparison, and we do that, then you can see that the ends, you can get them to touch there. They sort of point towards each other. And so that's how you can do the taco test. If you put the lens in inside out, the main problem is that it's going to move on your eye, it's not going to be comfortable, and your vision won't be clear. So that was a short introduction to how to use a contact lens, how to clean contact lens, how to get them into your eye, take them out of your eyes. Again, it's very important that you take them and test drive them for a good amount of time so you know how comfortable they are. I don't recommend that you go out and buy contact lenses until you use your lenses a few times so you know how they work, you know how they fit into your lifestyle, you know if it's going to be what you're looking for. There's different types of lenses. We can try a one-day lens, we can try a reusable 2-week lens or a reusable 1-month lens, depending on how many hours a day you're wearing them, what your work environment is, if you have any kind of dry eyes. We'll take all those things to consider. You'll find over time, it's like learning how to ride a bike or tie your shoe. The techniques of handling the lens becomes something you don't think about. It becomes automatic. So it's something that you need to spend a little bit of time to learn how to do at the beginning, but over time you can do this on autopilot without thinking much. Thanks for watching the video, and you can call my office for appointments or follow-ups or questions, and I'll be happy to talk to you. All right.